Welcome back to the Dr. Jeffrey Tauth Heart Talk Show. And today's show is called Dr. Jeffrey Tauth, your heart warning signs that demand action. And trust me, it's juicier than your cousin's peach cobbler. Let me hit you with something that'll make you sit up straighter than a Sunday service. 3 heart attack warning signs are so sneaky, so subtle that 40% of people ignore them until it's way too late. I'm talking about folks walking around for days, sometimes weeks, dismissing signals that their heart is literally screaming for help. Today we're going to decode these hidden messages your ticker is trying to send you, because knowledge isn't just power, it's the difference between celebrating your next birthday and becoming a cautionary tale. First up, let's talk about chest discomfort versus those Hollywood heart attacks you see in the movies. Forget everything you've learned from watching some actor dramatically clutch their chest and collapse on screen. That's about as realistic as my chances of winning a beauty pageant. Real heart attacks are sneakier than a cat burglar in velvet slippers. Most people describe it as pressure, like someone squeezing your chest in a not-so-friendly bear hug. I tell my patients it feels like an elephant decided your ribcage was the perfect place to take a nap. Here's what really gets me: the pain often comes and goes. Yep, entirely true. It's not this constant screaming agony like Hollywood wants you to believe. It might feel uncomfortable for a few minutes, then disappear, making you think everything's fine. Spoiler alert, everything is not fine. Your heart doesn't play practical jokes. When it's sending distress signals, you better believe there's a good reason. Now let's dive into what I call the sneaky upper body signals, and these are the real troublemakers. We're talking about pain that radiates to your left arm, your jaw, your neck, or your back. I can't tell you how many patients I've seen who spent days thinking they had a dental problem when their heart was the real culprit. Ladies, I'm looking at you especially here. Women are notorious for experiencing jaw and back pain during cardiac events. It's like your heart is playing telephone with the rest of your body, and sometimes the message gets a little scrambled. But here's the kicker that really keeps me up at night: shortness of breath without any chest pain whatsoever. This one's a major red flag, people. If you're suddenly huffing and puffing like the big bad wolf after climbing one flight of stairs, and there's no obvious reason, maybe I should see you in the clinic. We need to talk. These symptoms can show up days before a major cardiac event. Your heart is basically sending you a polite RSVP to disaster, hoping you'll decline the invitation. Let me tell you about Sarah, a 52-year-old patient who almost became a statistic. For 3 solid days, she ignored what she called indigestion and a persistent jaw ache, blamed it all on work stress and too many late nights chasing deadlines. Sound familiar? Finally, when the shortness of breath kicked in, she dragged herself to the emergency room, probably muttering about overreacting the whole drive there. Turns out the doctors found a 90% blockage in her main artery. 90%. We're talking about preventing a massive heart attack by the skin of her teeth. Sarah always tells people now that she learned to listen to her body's whispers before they turned into screams. Smart woman, that Sarah. Now here's where things get really interesting: the fatigue and nausea connection that most people completely miss. I'm talking about sudden, unexplained exhaustion that hits you like a freight train. This is especially common in women, and I can't make this stuff up. One day you're fine, the next day you feel like you've been hit by a truck, run over by a steamroller, and then asked to explain quantum physics. Add nausea, vomiting, or those cold sweats that make you feel clammy as a fish, and your heart might be waving a white flag. Sometimes patients tell me they thought they were coming down with the flu, except it wasn't flu season and nobody else around them was sick. When your body starts throwing this combination of symptoms at you, especially with any chest discomfort, don't walk to the phone, run. Call 911 immediately. Here's my actionable takeaway that I want burned into your brain like your mama's cornbread recipe. Trust your instincts. If something feels off, if your body is acting like a car making weird noises before it breaks down, get it checked out. Don't sit around waiting for those classic textbook symptoms because your heart didn't read the textbook. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.